So, Dr. Giles, as we talk about the qualifying conditions, there's one that's pretty common across all legal states, and it's probably because it's the most common reason that people use cannabis, and that's pain. In this case, chronic pain. Now, if I could ask you to first help us understand the difference, if I smash my hand with a hammer, my thumb is going to be aching. It's going to feel like that cartoon, right? It's like, but that's not chronic pain.
Yep.
What is chronic pain?
So chronic pain really refers, first of all, we have to zoom out and talk a little bit about inflammation. So when you crush your thumb, there's acute inflammation happening. That's normal. That's what should be happening. Inflammation is the first stage of healing a wound or healing anything. So if you smash your thumb, your immune system has to go and start cleaning up the damage. That's acute inflammation. What should happen is that it'll be cleaned up. It might take, days, weeks, whatever. It'll heal and then it'll be back to normal. The pain is gone because pain is part of inflammation. So pain is actually one of the keynotes of inflammation. So as the inflammation recedes, the pain goes away and your thumb is back to full function. Now, sometimes even with that, let's say you would smash your thumb, that inflammation, that acute inflammation can become chronic inflammation. That is bad. Chronic inflammation is bad. It is pathological. It causes tissue destruction. It involves different cells, different branches of the immune system. And chronic inflammation can have long-term ramifications, negative ramifications, including cancer. Chronic inflammation is a risk factor for cancer. So let's say, just using the thumb, let's say something was damaged or didn't fully heal, and maybe there was damage to the joint or something like that. And then chronic inflammation starts. So everything's healed, it looks normal, but you take an x-ray, you look into the joint and you see some erosion or you see various keynotes or signs of chronic inflammation. Now we have a problem. The immune system has gone awry. Why that matters with pain is that often that can cause chronic pain. A lot of things can cause chronic pain, but usually it's because there's a pathological underlying condition leading to the chronic pain. It can be lots and lots of things can lead to chronic pain, but it means that it doesn't go away, or if it does, it might cycle, upcycle and become worse sometimes, down cycle and become more manageable at other times. But essentially, whatever is causing the chronic pain is not going away or not going away anytime soon. So we have to modulate that. If they're not going to get out of the pain, we have to reduce their pain. And that can be done with lots of methods, including cannabis. So with chronic pain, again, there can be a lot of contributing factors, but if we're thinking about using cannabis medically for chronic pain, the first thing we have to say is that it can be opioid sparing, meaning if a person has chronic pain and they're already prescribed opiates or opioids, and it's something they need, again, if they're going to be in pain the rest of their lives, whatever their degenerative condition or neurological condition isn't going away, and we don't want them to just be suffering unnecessarily. If they're on long-term opioids, but they're not going to be able to get off of them, they can at least reduce them using cannabis. So if you increase cannabis, you can decrease the opioids used because cannabis can be so effective for pain. So when I'm talking about chronic pain with people, in general, THC does need to be part of the conversation here. CBD is definitely analgesic, and frequently I'll have people on high doses of oral CBD for pain, but really for breakthrough pain or for really intense pain, some THC should be on board because THC is particularly analgesic and antispasmodic, reduces like muscle spasticity, etc. So generally I'll have people on higher doses of oral CBD, and then they can use THC as needed for breakthrough pain or have different ratios available. If they're normally doing a 20-to-1 CBD, but when things are really bad, having a 5-to-1 or a 1-to-1, something like that, or even a 1-to-10, a higher THC preparation for the breakthrough pain. With oral dosing, I would say twice daily to 4 times daily is really minimal. Again, we're talking about chronic pain. It's not going away. They need it on a schedule, depending on their metabolism, either doing it twice a day or up to 4 times a day, just with their baseline oral dosing. Generally a higher dose CBD or higher ratio of CBD for that. And then, as I frequently say, that oral dose is preferred, but in this situation, inhaling particularly higher THC preparations, vape or flower or cartridges, whatever, for breakthrough pain, this would definitely be a reason to do that, because it's going to get into the body a lot more quickly. So if they're all of a sudden having a really bad breakthrough of pain, you want it in their bloodstream rapidly. You don't want to have to wait for the digestion to kick in. So with certain chronic pain conditions, including especially fibromyalgia, but also if you're seeing fibromyalgia with some sort of chronic digestive issue, and especially if it's also with migraines, which we'll get to later, when you see that fibromyalgia, digestive issues like IBS and migraines, I immediately have to think, even if I'm just seeing two of those three, I immediately have to think of endocannabinoid deficiency syndrome. And so for medical cannabis consultants, I would want them to also be thinking about that. Even just seeing fibromyalgia, because with an endocannabinoid deficiency, those people really need cannabinoids extra, non-endocannabinoids, so exocannabinoids, cannabinoids from outside sources to replete that deficiency. It's almost like they have a genetically mediated vitamin deficiency or other essential fatty acid deficiency, something like that. So they really do need to be taking, and it's not just from cannabis, cannabinoids are in other plants as well, but cannabis is the easiest and the strongest. So frequently, even just having relatively small amounts of CBD, but regularly, can dramatically improve fibromyalgia. Now that's not for everybody, but a lot of people. Terpene wise for chronic pain, I always recommend beta-caryophyllene and myrcene, because they're also antispasmodic and analgesic. And then myrcene actually interacts with naloxone, which is used for opioid withdrawal, or to cause opioid withdrawal, used for opioid overdoses. So just to be aware, again, for medical cannabis consultants, probably not something to micromanage, but there could be interactions there with opioids. And potentially myrcene is going to help alleviate things like opioid withdrawal, or could cause opioid withdrawal in other people, but it is analgesic. Myrcene is very widely distributed in cannabis also. So favoring those particular terpenes is in general going to be most effective for pain. As I generally always say too, supportive botanicals are also helpful. There's a lot of different things, a lot of different herbs that can be mixed with the cannabis or can be given additionally, not for a medical cannabis consultant, but definitely for other, for them to keep on the radar, because this could be a place where referral to a different integrative provider could be helpful. And then in the same vein as chronic pain, I think we can treat it very similarly, is arthritis. Arthritis is another qualifying condition, and it generally, the reason that it's problematic is it causes chronic pain. So for arthritis, this again is a place where I would recommend the THC being higher than for a lot of other conditions. So anywhere in the 10:1 to 1:1 range. So either higher CBD up to about equal between CBD and THC. Again, it's going to be the same recommendations that I just said for chronic pain, except with arthritis, you have to consider whether it's degenerative or autoimmune. And if it is autoimmune, degenerative is like osteoarthritis. That just is the wear and tear, and more so you're just trying to modulate pain. But if it's an autoimmune mediated arthritis, like lupus or psoriatic arthritis, rheumatoid arthritis, in that situation, I would definitely go higher on the CBD and also include CBG, because those two in particular are best for autoimmune disorders. And with that, if it's autoimmune, you want to reduce, autoimmunity just means overzealous immunity. So you want immune modulators, you want things that are going to reduce that pathological chronic inflammation I was talking about. So CBD and CBG in particular are really good for that, for the anti-inflammatory properties, immune modulatory effects. And for that, I would actually recommend limonene, more higher doses of limonene, or within the context of, more lemony smelling, tasting cultivars, because that is going to actually have more immune modulatory and anti-inflammatory effects.
And as you talk analgesia or analgesic effect, I want to clarify that means just pain relief. And so it's not a word maybe that everybody uses, but it's like we said, we started with pain because that's going to be the most common, and we know there's a lot of excitement in the arthritis community among providers as well, who some of whom say they can't believe that some of their arthritic patients are doing better. They didn't expect the results. Now, obviously not for everybody, but for some people, even with osteoarthritis, to see not a reset, but some improvement where the strategy had been just to slow down the degeneration, and in some cases, they're getting better results than that even.
Yep, absolutely. Just like the conversation I had at the beginning about, well, I thought cannabis was just used for symptoms related to cancer, and I found out actually it can be used to bolster the immune system and have cytotoxic toxic effects. Same thing, especially with immune mediated causes of arthritis.
Mm-hmm.
You actually can potentially start reversing some of that damage and actually really halt that pathophysiology by utilizing cannabis. So it's not going to just be analgesic, reduce the pain, but it can actually have reduce the causes of the pain, which is autoimmune degeneration in that particular situation.
Which is pretty amazing. We know that cannabis is not a cure-all, and we always want to we'd much rather under-promise and over-deliver. you know, um, and it's different for everybody. But certainly there are good stories out there to be heard and to be had. And so when you work with a customer in the retail space, students online, please encourage people to come back and tell you how things are working or not working, because that's part of closing the loop with you. And then of course you hope and please encourage them to do the same thing with their physicians. We hope that people are going to physicians they can talk to about their cannabis use, and if they are not, there are always other physicians. That's not for yours to suggest, but there are plenty of cannabis-friendly physicians to choose from. It's not like you're in a place that is slower to come online.